Okay, Harlan, we haven't listened to you. We have gotten older. We are limping. We no longer can dunk. We have pain. We're taking Advil. We're taking Motrin or whatever else. And we get to the point that we go to Dr. Clapper. And we say, Dr. Clapper, you got to do something. Can you help me? Do I need surgery? What is the decision making that we go through to decide whether we need to go under the knife or not? Because a lot of people will say, don't have back surgery, don't have done this to you. Take this pill and you're gonna be fine. Help me out here.
I used to think that the criminal mind, God made good and made evil. But the evil ones went into real estate. They went into those areas. But beautiful world of medicine, those bright eyes that I've always had watching the world through the eyes of a nurse, my mother, take care of people, take care of you. So if you go into medicine, you're with the people who look to help society. Guess what? The same son of a bitch criminals that, so you have to be very careful. There are people who take advantage of that beautiful profession who do anything to biopsy your wallet. And I don't mean to come off as being this way, but I have become hardened after 26 years of being a surgeon in Los Angeles. And you'll see it now. Wear a sleeve with copper in it you see on television. Like this is gonna... There was a time when people went to the shoe store to buy shoes and they said, hey, this is a better gimmick, we can take an x-ray of your foot, right? Tom McCann used to do this, a fluoroscopy of your foot. And people would say, can this hurt you? No, it's invisible. Thank you, they're radiating your foot to do this. Don't kid yourself. This, people they treated acting. How could it hurt you? It's invisible. You gotta be careful. When it sounds too good to be true, it is. So, with that being said, you better ask the right questions. You always want to try to avoid surgery, and you're all intelligent. So if someone says something and it sounds too good to be true, take glucosamine and you're going to grow cartilage, or take Synvisc and you're going to lubricate the joint. Trust me, the hair on my head is not coming back again with a shampoo. The dentist still has to take your tooth out and pull it. So there are two reasons for you to know it is time. That conservative treatment has failed. And I've written books, I brought one of them here today, Heal Your Hips, Heal Your Knees, about water exercises. This brilliant idea of making your weight-bearing joints, of your lower back, your hips, your knees, your ankles, weightless, belly button high water. Simple. You just walk across, get to the end, and backwards. Yes, mechanically you're unloading the joint, and the resistance on the muscle makes you stronger. So you have a better shock absorber above your knee, above your hip, above your back. But it works so well, there's got to be more to it. So think about this. Inside your knee right now, when you close your eyes, each of you, straighten and bend your knee. Your brain knows you straightened and bent your knee, even though your eyes are closed. That is because inside your tendon, your ACL and your posterior cruciate ligament, is a sensor called a Golgi tendon. That is the receptor to your brain of position sense, proprioception. When you become arthritic or you injure your ligament, slow, steady degeneration, guess what you lose? You lose the Golgi tendon. It gets deteriorated. So I have all these very realistic patients. Tommy, for example, comes to my office wearing a crappy J.C. Penney sleeve, going, I know, Dr. Clapper, this doesn't do anything, but it makes my knee feel more secure. Are you kidding me? How the hell can a simple sleeve with no hinges, no nothing, make you feel more secure? But there is a very elegant answer. In your skin are receptors, proprioception, different than the Golgi tendon. And the very fact that you have a sleeve touching your skin, now the brain can once again give position sense so it feels more secure. This is also what I believe the water does, because your skin is touching the water. So, to finally, the two reasons you now say it's time for surgery, and we can get into the miracles of what we can do in the operating room. The pain is failing conservative treatment. And I don't mean noise. Joints that make noise, don't worry about. Pain, swelling, limited motion, more symptoms in your hip, waking you up from a deep sleep. Your knee, you can't now. That's one reason, more symptoms in that joint. Second reason, if now your back hurts because of your awkward gait, because of your bad knee, your bad hip, and you start screwing up innocent bystanders, particularly backs. I don't care who the surgeon is, we don't do a good job of spine surgery. We're good at knees, we're good at hips, we're good at shoulders. If you start screwing up innocent bystanders, then it's also time for surgery.